Hi, I'm Esther from Skylark First Aid. I'm going to do a little video today about wounds with an embedded object in it. So if you watched one of my previous videos about treating minor wounds, I mentioned that sometimes when you come across a wound, it'll have an item actually in it, embedded into it, and we shouldn't move that. We should not take it out because that could accelerate the bleeding. That item could be plugging the gap and actually stopping the blood escaping from the blood vessel. So it's really important, even though it seems totally the wrong thing to do, that you actually leave it embedded and stuck into the person. Obviously, if they've pulled it out themselves before you got to them, you're not going to go and stick it back in again, but try and encourage somebody to leave it there, which is difficult in itself. So I've got some gruesome objects to show you. You might have something like that where there's a knife stuck in somebody, and this is mainly for arms and legs, for limbs, or a piece of glass, or something quite small like a nail or a screw or something like that might be stuck into somebody. So how would we go about bandaging these, and why do we need to bandage them? Well, you need to cover them for several reasons. This item, because we're leaving it in there, could wiggle about and move about if it's quite unsupported, and that will cause more damage, which obviously we don't want. So we want to try and limit the damage that's happening. Also, we do need to stop blood escaping. You know, we don't want somebody to keep bleeding, so we need to try and stop the blood loss. And importantly, we want to try and stop infection and germs getting into the wound as well. So we're doing those three things with the bandage that we're going to create. We're supporting the object, stopping infection getting in, and stopping blood getting out. So there's a few things you can use. Most importantly, to protect you, are your gloves. So make sure you put your first aid gloves on before you touch anybody that's bleeding. It is a bodily fluid, it's biohazard, so make sure you don't touch it. Then you're going to need things out of your first aid kit ideally. Bandages, these are wound dressings. You've got large and medium, any size will do. Things like triangular bandages, slings are always useful. But you know what? If you haven't got first aid kit, use anything that you've got, as long as it's fairly clean. Tea towels, a clean dishcloth, a scarf, somebody's tie. Do you know, you could use your socks if you had to. It doesn't matter because this is really important. So the first thing that we're going to do, we'll look at the knife first of all, is we need to support the object. Obviously we can't press on top of it, that would just push it further in, so obviously don't do that. These wound dressings are ideal left rolled up, so don't stretch them out. Use a couple of rolled up bandages and put them either side of the object. Obviously it depends which way round the object's stuck in, so you might go across, but for this knife, in that direction, I'm going to put them either side, like that. And then I would use another bandage to keep these in place. So I would then go side to side around the object, keeping it in place, not too tightly, it's just a matter of making sure it's not going to move and supporting it. So once the bandage is finished, I would then find an area to tuck it in, stop it coming undone. So I've supported the object, those bandages are going to stop blood escaping, certainly soak blood up, and I've kept it nice and clean so it will stop infection getting in, so that's a really good one to do. What about something that's a bit smaller? Just take those off. Something like that nail, that's quite small, that one's quite dramatic, isn't it? But we still need to treat that in a similar way. So again, I would use my 2 rolled up bandages. Which way round I don't think matters with this because it's a round object. I'm going to put them that way. Now this one, because the bandages are now higher up than the actual nail, I can go over the top because I know I'm not adding any pressure onto the actual object and pushing it further inside. So then I would fairly gently just secure that in place like that. You can use other things, it doesn't have to be bandages. So let's have a go with my piece of glass. You can use a sling, these are really useful. So get your sling, if you've run out of bandages, and rather quickly roll it up into a long strip of fabric like that. I would probably then fold it in half, and then you could use this to gently wrap around the sides of the object, so it's doing a similar job to those two bandages that we did earlier on. So again then, I could either use my bandage to keep this in place like I did earlier on, or you could roll up another sling and use that to keep the item in place. So it doesn't have to be bandages, it can be anything that you've got that's reasonably clean and you can support around the side of the object and then tie it in place. Get this person to hospital as soon as you possibly can. I think it depends on what the item is, where in their body it's located, how bad the blood loss is and how bad the person is, as to whether you phone 999 and wait for the ambulance or whether you try and transport them there yourself. It just depends on the situation. Phone 999 and ask their advice, certainly. I think that's a really good idea. Well, I hope that's been some help for you, treating an embedded object. If you want to find out more about me or the courses that I do, go to my website. It's skylarkfirstaid.co.uk, or I'm on Facebook and Instagram at Skylark First Aid. Thank you.